Hi, I'm Abigail McCarthy. I'm going to be talking about my internship this summer at the Iowa Cancer Consortium. Um, my internship allowed me to work alongside top public health leaders. The main goal for this internship was to help the consortium combat the effects of COVID-19 on cancer care. I worked in the HPV and colorectal work groups, both of which have been greatly affected by COVID-19. A major problem that public health is currently facing is a decrease in vaccinations. Myself and the HPV work group focused on this issue and discussed how we were going to get vaccinations back on track. I also had the opportunity to help plan the 2020 Iowa Cancer Summit. Many projects, studies, and plans for cancer care were uprooted by COVID-19. Colorectal cancer is the second leading cancer killer in the United States and is often asymptomatic, making screening even more important. Vaccinations for HPV have been decreased by 50%, and the return of students to schools is very alarming, as many of them will not have their vaccinations. The mission of the Iowa Cancer Consortium overall is to reduce cancer incidence and mortality in Iowa through collaborative efforts that provide services and programs directed towards comprehensive cancer prevention and control. Thus, my work related to COVID-19 and cancer care apply directly to the consortium's mission. I also attended virtual roundtables about certain cancer topics with health professionals from all over the country, specifically the 2020 National HPV Vaccination Roundtable. Here, scientific data was presented that I had the honor to report back to the staff meetings every week. And I was also honored to be included in the monthly check-in meetings with the American Cancer Society, Iowa Department of Public Health, and the consortium, in which many topics of cancer and COVID-19 were discussed. Another role that I had mentioned was planning the Iowa Cancer Summit for this year with the implementation team. This allowed me to talk one-on-one with health professionals all over the state, and I got to know them better, they got to know me, and I was introduced to a lot of top public health leaders. So I was very grateful for that. Everything was somewhat challenging being in a pandemic, but it was very interesting to be involved in this and be a part of the mitigation strategies and problem solving. I believe my biggest accomplishment in general was being a part of a nonprofit and engaging in discussions that will impact Iowans' lives, and just meeting top health officials that I would not have the opportunity to have done really with any other internship other than this one. What got me started in cancer and made me prepared for this internship was being involved in the Red Shamrock Student Org, interacting with the pediatric cancer patients at the Iowa Stud Family Children's Hospital, my classes, and my own cancer experience. So I improved my skills in this internship that will help me further in my studies. I improved my skills on communication and time management, focusing on my targeted audience when speaking or writing. And I actually discovered that I liked working with other people in teams, which I didn't necessarily like before. And it makes me look at different perspectives and think deeper and go out of the box. It also allowed me to conceptualize and interpret scientific data that is presented in more of a scientific way and thinking of it in different ways. This internship exceeded my expectations and tremendously helped me towards my personal and professional goals. And it reassured me that my calling is to work with cancer and to help people. To be a part of the most important conversations of the century concerning cancer care and public health, I feel unbelievably grateful. It allowed me to see firsthand discussions, that problem-solving mitigation strategies within the public health field. I'm just very grateful for this internship, and I thank my supervisor, Tessa Mills, for being so supportive and welcoming. Thank you.